There is a YouTube channel that I like very much called Smart Trucking, and I listen to it often. The man who narrates it has many good stories and lots of good advice. But one piece of advice that he often gives is that truckers should work for small mom and pop trucking companies. There, you're not just a number. You're not just a cog in the great machine. You're a person, and they will look out for you and take good care of you. Now, this makes lots of sense if, like the person who runs the channel, you live in Canada, where medical care is provided by the government for every citizen that lives in Canada. But it is not applicable at all in the United States. In the United States, your employer decides whether or not you have access to medical insurance. Now, that may be a whim of the employer. I don't want to provide medical insurance. Good night. You know how much that costs? I wouldn't be able to keep employees. It may be they just can't afford to do it. There's just no way. They have a small business, has 24 employees. There's just no way. Or it could be, such as I've experienced in the past, it's a small organization with only 30 people, but the people who are part of the family that started the business and work in the office areas, they get medical insurance. Now, that medical insurance is available to everyone, but it's wonderful medical insurance, but the premiums are outrageous. And the contributions that an employee has to make are huge. What that means is that people who are in the family always get their salaries bumped higher and higher every time there's an increase in the premium for the medical insurance. But for the people on the floor, the peons, the bozo employees, it would take easily 3/4 of their income in order to participate in this really great medical insurance. And so in that sense, they aren't providing medical insurance at all. But when you go and fill out forms and ask, does your employer provide medical insurance? The answer is yes. But there's absolutely no one except for the central family that can afford it. This issue consistently brings up from conservatives who are trying to conserve things as they are the idea that we already have universal health care. It's called the emergency room. Unless you're going to an emergency room with a gash that needs stitches or a broken bone that needs to be set, something remarkably simple, then you are in a rough row to hoe. Because here's what happens. You go in with a terrible pain somewhere in your body. Take your pick. Go in with a terrible pain. And they will provide emergency care. They will take care of the symptom. They will oxycodone or Percocet away that pain and send you home with a few pills of Percocet. And they will say, now, over the next week, you need to consult your doctor about this. And this is the medical care you get at an emergency room when you don't have medical insurance. Now, the person has just taken on a $2,200 emergency room bill, depending on where they are in the country. And it won't be but a matter of weeks before the hospital turns that bill over to a collections agency that will dun that person day and night and keep on adding fees and fees and fees. for a huge portion of America. When you say, now be sure to follow up on this with your doctor, that is laughable. They don't have a general practitioner physician, much less do they have a gastroenterologist or whatever that GP would send them to. Nor can they afford to take on another huge pile of debt to a general practitioner, and especially that specialist that's going to come in. My point is to say that people all have access to medical care because they have access to short-term emergency room treatment just leads to death, and more death. If we are looking for a way to be pro-life, the best way is to provide medical care for everyone.